everyone is doing safe during this global crisis, and I wish God and pray to God for a speedy recovery for those who are recouping. Today's session, I'm Dr. Judith Christina, Periodontist with Apollo Dental, and today's session is on oral health in pregnancy. Pregnancy is a unique period in every woman's life, and it is characterized by complex physiological changes. Every mother-to-be would often wonder, what does oral health have to do with my pregnancy, or vice versa? What does pregnancy do to my oral health? Pregnancy affects almost every aspect of a woman's life, and the oral cavity is no exception. The hormonal changes during your pregnancy would cause changes to your entire body, including your oral cavity. A normal pregnancy usually lasts for about 40 weeks, that is roughly around 280 days, and it is usually divided into 3 trimesters, the first, second, and the third trimester. During the first trimester, the organs of your baby are in the developing stage. Your baby is in the most vulnerable stage during this period for any malformations. By the second trimester, most of the organ development is completed, and this is usually considered as the safest period for dental treatments. During the third trimester, the uterus of the pregnant lady would expand to accommodate the growing baby, and it would compress on the important vessels that bring the blood supply, such as the femoral artery or aorta. And the pregnant female would be in a compromised position to cooperate for a dental treatment. Now let us look into what are the oral manifestations of pregnancy. The most common is the pregnancy gingivitis. Around 40% of the pregnant individuals, they report pregnancy gingivitis. Pregnancy as such doesn't directly cause pregnancy gingivitis, but the hormonal changes like the increase in your estrogen and progesterone hormones can cause your gums to respond in an exaggerated manner to even the slightest amount of the debris which are found on your tooth, such as the bacterial plaque and calculus. So what is this pregnancy gingivitis? It is nothing but the inflammation of your gums, which becomes red, sore, and it easily bleeds when you brush. It usually begins around the second month of your pregnancy and is most severely seen during your 8th month. What will happen if you ignore this issue? As such, pregnancy gingivitis is usually painless, and it will revert to normal once your delivery happens. But in some cases, there are chances of this gingivitis involving your deeper tissues inside your gums, such as the bone, and it can progress to something known as the periodontitis. Periodontitis is nothing but a severe form of gum disease. Numerous studies have shown that periodontitis during your pregnancy have adverse effects on your pregnancy as well, such as preterm delivery. That is, delivery that occurs prior to 37 weeks of your whole pregnancy term. And also there are studies which have shown that the babies are born with low birth weight. So what to do to prevent this from happening? Ensure a complete oral hygiene maintenance. Make sure you brush twice daily. Keep changing your toothbrush every 3 months. And use interdental cleaning aids for cleaning the in between your tooth, like flossing, and other interdental aids like water pick. Also use a mouth rinse, but make sure you don't use mouth rinse with alcohol content. Also, professional services like dental scaling can help you in this issue. In rare cases, the inflamed gums can produce a tumor-like mass known as the pregnancy tumor. Although it is known as a pregnancy tumor, it is not cancerous, but just the inflammation of the gums. It usually presents as a mushroom-shaped magenta color protrusion from your gums seen on your outer surface. So what do you do when you have this pregnancy tumors? Pregnancy tumors as such are painless, but they can accumulate a lot of food debris underneath, and they can enlarge in size. Once they enlarge in size, they can interfere with your eating, they can interfere with your speech, they can interfere with your brushing, which when they become infected, they can become ulcerated and start giving you pain. What to do if you have this pregnancy tumor? Pregnancy tumors usually resolves once your delivery is done, but if in case it gives you any pain, maintain a good oral hygiene. See to that there are no food debris that are getting accumulated beneath it. However, it can become so large that it interferes with your daily activity, a surgical or a laser excision can be done. Another most common oral manifestation is a perimyelitis. Perimyelitis is nothing but the wearing of your enamel of your tooth due to acid attack. Pregnant women usually have morning sickness. When your morning sickness is too severe, what will happen? The digestive acids from your stomach, they can cause erosion of the enamel of your tooth. It is especially seen in the inner surfaces of your front teeth. To prevent this from happening, what you'd have to do is immediately after you vomit, just rinse with plain water or a mouth rinse containing baking soda or a basic pH mouth rinse. Another common thing which is encountered during pregnancy is the gestational diabetes. Around 2 to 5% of the pregnant individuals, they have gestational diabetes. Gestational diabetes as such doesn't cause any issue, but it poses a threat for developing type 2 diabetes later in life. What will happen when you have gestational diabetes during your pregnancy to your oral cavity? Diabetes as such causes periodontitis, and periodontitis in turn, it can cause adverse pregnancy outcomes like preterm labor and low birth weight babies. And the vicious cycle continues. When you have periodontitis, your diabetic levels also would not be able to be in control. Make sure you get in touch with your gynecologist, follow proper protocols, and make sure that your blood glucose levels are in control. Another thing is dental caries. Dental caries, most of the pregnant women have food cravings. They tend to eat in a lot of junk food, sticky food and sugary stuff. All this can aid in the development of dental caries. Dental caries would be in a very initial stage during your pregnancy, but if you develop pain, you would be in a compromised situation where you would have to go in for a dental treatment. Now that we have seen what are all the manifestations of the pregnancy which occurs in the oral cavity, a lot of questions would arise in your mind. The most common question which I am getting here by Mr. Roger Apollo is dental treatment safe during pregnancy? Yes, dental treatments are absolutely safe during your pregnancy. The second trimester is the most common period where you can get your routine dental checkups done. Elective dental procedures like your tooth extraction, or if you want an implant placement to be done, you can postpone it till your delivery. But your regular scaling and your polishing and maintenance of oral hygiene can be done during your pregnancy also. And I would like to add one tip here. If you are planning for a pregnancy, make sure you book an appointment with the dentist prior to your pregnancy and get all your major dental treatments done prior to your pregnancy, like your wisdom tooth removal. Are x-rays safe during pregnancy? Yes. X-ray radiations of 5 to 10 radiations are only known to cause any teratogenic effect, that is harmful effects on the developing fetus. In modern dental x-rays, the radiation is just 0.01 or even lesser than that, and it is also directed away from your uterus. So it is usually considered safe, and we'll also be providing you with lead aprons to safeguard you from the x-rays. But during the first trimester, it is usually avoided. Are dental medications hazardous? Dental medications, the common dental medications which we give, like the antibiotics and painkillers, are not hazardous for the baby as well as for you during your pregnancy, like your paracetamol and antibiotics like amoxicillin, etc. However, there are few antibiotics which are to be avoided during your pregnancy. Will dental medication cause harm to the baby? Yes. As I said, a few medications like tetracyclines, when they are taken during your pregnancy, can cause skeletal deformities and discoloration of your tooth in your babies. Can dental problems transmit from mother to the baby? The oral manifestation which all I shared previously as such does not transfer directly from the mother to the baby. But if the mother is prone to have a lot of dental caries, she'd be in close contact with the baby soon after the delivery. Almost 24 hours contact would be there. The caries causing bacteria can transmit from the mother to the baby. Does diet influence the oral health during pregnancy? Yeah, during pregnancy, it is always suggested to have a nutritious diet with a lot of vitamins, especially vitamin C's and all that. When you have food cravings, if you've taken a lot of junk food and sticky food stuff, they can cause dental caries during your pregnancy. And if you are taking sugar-free stuff or any vitamins, that will have a positive effect on your oral health as well. Can LA be given during pregnancy? Yes, local anesthesia, which we generally use in dental surgery, is lignocaine, and it is safe for use during pregnancy. But make sure that the procedure doesn't last for about more than 30 minutes, and also a minimal LA is given to achieve the local anesthetic effect. Any more questions? Doctor, is it safe to take dental treatment during this COVID pandemic? I would suggest you not to step out of your home until and unless it is real emergencies. We are available for video consultations. Also, you can directly take up a video consultation with your dentist and get your treatment sorted. If at all is needed, visit a safer place. What is the relation between gums and crown? Why I am getting food lodgement after my crown and my doctor says there is bone loss? See, once you get your crown, you'd have to take care of it more than how you care for your natural tooth. If your crown is over contour, that is, if it is protruding inside your gums, it can cause food lodgement. If the crown is not made properly, also it can cause food lodgement. And direct impact of the crown on the gums can cause the underlying bone to get lost. Any more questions? So I hope this session was useful to everyone. All of you stay safe and be healthy in this pandemic situation. Thank you.